7:17. Welcome back. You're watching BT Vancouver. Thanks for joining us on this Wednesday morning. Well, some people have been comparing COVID-19 to the seasonal flu bug, and that includes U.S. President Donald Trump. Joining us now is City News reporter Xiaoli Li, who joins us from Ottawa now. And Xiao, you covered this story yesterday. First off, let's start with what are the similarities between the flu and COVID-19?
Yeah, I mean, on a surface level, it's really easy to see the similarities there because they're both respiratory infections and the symptoms look very similar. Things like cough, shortness of breath, fever, and a runny nose, and both can result in complications if you have those underlying medical conditions. Both are transmissible through droplets in the air and both hit long-term care homes pretty hard because that's an environment where you've got recirculated air, you've got residents who typically have existing medical problems. And for both COVID and influenza, people can be infected and spreading the disease without showing symptoms, though it does take longer for COVID symptoms to appear. It's important to note we are talking about influenza here, though, like the actual seasonal flu. We're not talking about a stomach flu or a colloquial use of the word flu. We're talking about influenza.
Right, and I bet there's going to be a lot of confusion as we head into this influenza season. So what are doctors saying in terms of differences between them?
The differences are really stark. I talked to an influenza expert yesterday at the University of Toronto, Dr. Barry Pecos, and flu symptoms, they develop in just a few days once you've been infected, as short as 1 day. But with COVID, it could take around 5 days. That means there's that period where you're contagious, but you're not aware, and that period is longer with COVID. Maybe the biggest difference that he highlighted, doctors know what to do when someone has influenza. They have antivirals that they can prescribe. There's an annual flu vaccine that's pretty effective, some years as low as 30%, some years as high as 60%, but medical experts, they've been studying the flu for over a century now, so there's thousands and thousands of pages of research and data documenting what works, what doesn't work, why it works, why it doesn't work, but there's nothing like that for COVID yet. We're still in new territory here. I think you'll recall earlier it was called the novel coronavirus because novel means new. And while there's vaccines, there's treatments in development, we still don't have that backlog of experience that really gives doctors the confidence for what to do. And then there's the fatality rate. We mentioned the Donald Trump tweet. He said some years over 100,000 people die of flu. It's not clear if he was talking about America or worldwide, but the rates of death are a lot higher with COVID. Dr. Pecos, I talked to yesterday, he said it's sometimes as high as 20 times higher. Right now, Health Canada data, I just checked it, it says we have 171,000 total cases in Canada. That's recovered as well, but 9,500 deaths. That puts our fatality rate at just under 18%, 1 in 5 cases resulting in death. That doesn't account for other factors like when outbreaks happen in a long-term care home, but that number is pretty scary.
It is very alarming. All right, Xiao, just one more question for you. Is it possible to catch the flu and COVID-19 at the same time?
Absolutely. As far as we're aware, doctors say there's no reason why you can't catch both, and that's why they're pushing everyone so hard to get the flu vaccine this year. Because obviously, if you have the flu, you're going to be at higher risk of catching COVID just because your immune system is weaker, and the opposite is true as well. So that's why there's that big push to get yourself to get the vaccine, even if you don't normally get it.
All right. I guess we got to wash our hands and make sure we're taking all the precautions as we head into this flu season. Xiao, nice to see you as always. We'll see you next week at the same time.
See you then.
Okay, 7:21 now here.